I hope everyone's doing well. And someone said it earlier, I miss seeing everybody. It's just so fun to see the pictures pop up and see everybody on the phone. So I hope everybody's doing well. I have 3 little short housekeeping issues to talk about. And the first one is to let you know that everybody is going to be muted. You'll automatically be muted by Christine. And near the end of the presentations, I know you'll have questions for our 2 fabulous presenters today. And when you have a question, unmute your screen. Please say your name so we can see who's speaking and asking the question. And then when you're done with your question, mute your screen again. Okay, so we'll do that at the very end. But for the time being during the presentation, you'll all be muted. This is our first time to do a virtual meeting, and so bear with us. I think everything should work out quite well. Most of us have all had quite a bit of experience with Zoom. So we're here to talk about COVID-19, what's happening in the world. It's been a huge change since the last time we talked. We're going to quickly talk about what's happening in Arizona. We're going to talk about what's happening at Banner and how Banner has become prepared. And we're going to talk about tools and techniques for all of us to deal with COVID-19, and really also how to help our friends and families and people who are struggling. So we're going to have some great discussion about that as well. So I want to start just by giving you just a brief overview of Arizona. You probably all keep up on it on a daily basis, but I wanted to share these numbers are from the Arizona Republic this morning. In Arizona, as of about 8 o'clock this morning, probably a little earlier than that, we have 7,202 cases, and we've had 304 deaths. In Maricopa County, we have 3,723 cases and 140 deaths. That's very low compared to, obviously, New York and some other states as well. There are certain zip codes that are a little hotter than others. Last week it was Paradise Valley, had a lot of cases. We know the Indian Reservation is also inundated with cases compared to their population, which is smaller, obviously, than some other cities. Tucson's had a problem, and Flagstaff recently is getting inundated from the Indian Reservation. They're bringing those patients to Flagstaff. So Flagstaff is a little stressed right now with COVID-19. So just a brief overview of what's going on in Arizona. What I'd like to do is just quickly move to introduce you to our 2 physicians that are going to be speaking to us, our experts today. We have Will Holland, MD, and Dr. Daniel Drain. And I'm going to go ahead and share a little bit of information about both of them, and then we'll start with Dr. Holland. So Dr. Holland is officially the Vice President of Care Management and Chief Medical Informatics Officer at Banner Health. He provides system-level transformational leadership to support integrated care delivery. He drives clinical outcomes. He manages the risk of populations. He engages the consumer. His responsibilities include system quality, safety, infection, prevention, regulatory, clinical device evaluation, physician leadership development, informatics, the simulation center, which we had an opportunity to visit last year, credentialing, and clinical process improvement. And I don't know how he does all that. I have no clue. He earned his BS in microbiology at Texas A&M and then went to Baylor College of Medicine in Houston. He completed his residency in 2004 here at the training center, the family medicine at that time, Banner Good Samaritan Family Medicine residency in Phoenix. And in 2010, he was named Medical Informatics, and this is important, Medical Informatics MBL National Library of Medicine Course Fellow. This guy knows a lot about informatics, IT. I think that's how he started at Banner. I think he started in 2010 at Banner in the IT department and now has really expanded his role to cover all those other areas. So very qualified to talk to us today. I'm excited to hear him. Then we have Dr. Daniel Drain, and Dr. Daniel Drain is the Director of Wellness for undergraduate and graduate medical education, and an assistant professor of practice in internal medicine at the University of Arizona College of Medicine here in Phoenix. He works with medical students at the college, the residents, the fellows at Banner University Medical Center in Phoenix. He helps to reduce their anxiety, depression, and burnout, which I'm sure is super high right now. He also makes system and policy recommendations to administrators, program directors, and college leadership to improve the overall environment and well-being of these medical trainees. He's also responsible for the curriculum training and resource development around well-being and mental health at the college. That's a huge job. He received his BA in political science from Loyola Marymount, his master's in higher and post-secondary education from ASU, and his doctorate of education in educational leadership and innovation from ASU. He has worked at the U of A College of Medicine in Phoenix in student services and wellness for about the past 7.5 years. So we have two fabulous, fabulous folks with us today, and I can't wait to hear what they have to say. So we're gonna start with Dr. Holland first. And I have just a kind of a general question, if you will, Dr. Holland, to start with. Banner Health is one of the largest healthcare systems, obviously, in the United States. It's huge. Can you describe for us what Banner has done in order to prepare for this pandemic, first of all? And then the second part of the question is, what innovations have you seen at Banner Health which will help to meet the needs of the patients with COVID-19? So kind of a two-part question, if you will. Dr. Holland?
Yeah, sure. And Suzanne, can you hear me okay?
I sure can, yes.
Okay. Want to just warn you guys, I have 3 very small children and they're extremely busy. So you might see people running around behind me or noise from the other room. If that happens, I'll try to mute for a second before I come back on. But maybe I could answer one additional piece on the front end and just talk about what this feels like. It's, I've been in healthcare for 20 years and I've seen a lot of different things come along throughout that time frame. And this feels like one of the most dynamic things that I've seen before. So you heard Suzanne talk about some of the numbers that we're seeing in Arizona. And I'll tell you, the numbers, just since you looked at the numbers this morning versus now, are even higher. So as far as positives in Arizona, we're several hundred patients higher than we were even this morning when you looked at those numbers. And deaths are up another 14 over when you looked at those numbers this morning. We're in a lot of different markets. You'll see things that are very similar in that space as well. And while I think Banner is a very well-prepared organization, we really focus heavily on standardization throughout there so that folks can have the same experience anywhere that they may interact with Banner, the same good clinical experience, the same good consumer experience, all those types of pieces as they go through. This is so dynamic that we're having to look and make changes on an almost daily basis of how to respond to some of these things. The standardization really helps. And so one of the things that we did early in March is we stood up our EOC, which I don't know how familiar you are with the concept of an EOC, but it's an Emergency Operations Council. And basically it's a team that initially was meeting daily, several times a day, to divide up all of the planning work. Usually when you're faced with something like this that's dynamic, that new data and information is coming out on a daily basis, that you're having to look at trends in your facilities that have real challenges from a supply chain standpoint around personal protective equipment for physicians and nurses and others, you've got to be planning well ahead of the challenges that you have right now. And so in the case of Banner, this became the primary focus. We stood up a team that had many different groups that came together that made up that larger team. One's focused on protecting our employees, one's making sure that we can screen and test patients. And it led to a whole host of different activities, whether that's collection sites that you've probably heard advertised in the news to be tested. You may have heard some of the things that we've been doing around creating personal protective equipment ourselves, designing new models. All of that came out of that process, highly focused. And in fact, basically every single function, whether it's clinical, operational, financial within the organization, was intensely focused on this planning exercise. I think that allowed us to get well out ahead of this. In fact, from a personal protective equipment standpoint, we still have a lot of work to do, but I think we've been able to put ourselves in a much better position than a lot of our peers across the nation from that, with some of that very aggressive and active planning. That's really the initial phase of any kind of engagement or activity around something like this. The second piece that you have to do is really start working on an execution phase of this emergency activity. And so execution in something like this is really around making sure that you almost run a daily air traffic control of the things that you need to do. And so imagine, as you read in the newspapers, I'm sure, and watched on the TV media, ventilator usage is a really important thing for these types of patients, making sure that you have beds available, ventilators available, all of those types of things. And so it led to teams making sure that we knew all the different ventilators we had, and even knew non-traditional ways that we may be able to ventilate patients and provide airway support if needed. And then stood up dashboards and almost an air traffic control to make sure that we were balancing our patients across the system. Same mindset would go to oxygen. Same mindset would go to transferring patients in, for instance, from the Indian reservation that you heard, making sure that we're balancing them across the resources we have in the organization. And then frankly, a lot of partnership with other health systems in town to share things that we've learned with things that they've learned so that we can be consistent in the way that we're doing this. A lot of work still underway, frankly, from an execution standpoint on this. And I suspect we will continue this. You've probably heard news that we've peaked. Well, I would tell you in Arizona, I'm not sure that we've peaked from the total number of cases yet. We still seem a little bit of a trend increasing. Watching that very closely. And then the last piece of any kind of emergency operations council exercise like this is what we call recovery. And so as you can imagine, we delayed elective surgeries for patients, an effort to try to stand up all these processes I just described to make it as safe as we can for our patients and as safe as we can for our employees that are in there. But these patients do need to have these procedures done. They do need to receive services. They do need to receive care. And given the fact that I think COVID will be with us for probably the next 12 to 18 months to some level, we've got to make sure that we can start to provide services again that patients need in as safe an environment as we can. So we've set up some activities specifically around that. All of these types of things, whether it's planning work, or execution work, or whether it's recovery type planning, they all kind of function in parallel, and they lead us to start doing and learning about things we haven't done before. So as an example, we recycle now types of protective equipment that we would have never thought to recycle before. We are creating some of our own personal protective equipment for employees. In fact, we've done that with surgical masks. We're doing that on a larger scale now around that. And we've even innovated a new type of surgical mask for folks to use. And we're starting to do the same types of things with procedural gowns for folks to wear as well. And I think those are kind of big pieces. We've rolled out telemedicine at a speed that I didn't think was possible. We've rolled out telemedicine capability in our facilities that we haven't had before. We've rapidly rolled out telemedicine capability in our ambulatory space so that we can have visual interactions with our patients and care for them. So I think there's a whole host of different pieces like that, from leveraging ventilators in different ways than we've used before. We've actually looked at potentially, if needed, turning our OR spaces into ICU spaces and using the OR ventilators in those types of ways. And the fun and interesting thing about this is the innovations around this aren't coming from senior leaders in the organization. These are coming from frontline folks that we've been able to gauge in some of the structures that we have that are bringing ideas forward. Some of them are brilliant, and we're sharing them with other health systems out there so that they can learn from those as well. So I think it's a really exciting time. We're still very early in this. I think there's a few decisions I probably would have done differently, knowing what I know now. Healthcare workers safe, and they can go out there and save lives. And that's what this is all about. So I think it's been an exciting time. It's been certainly a scary and trying time as we've gone through this, but I think in many ways it's brought out the best of a lot of people.
Dr. Holland, I guess you touched on it just a little bit, but how do you see healthcare changing as this pandemic either lessens or goes away? We hope it goes away, but how do you see healthcare changing in the future? You mentioned telemedicine. What else?
So I wish I had a crystal ball. I would be much better at my investing portfolio than I am if I had that. But I will tell you, I think there's probably a couple of things that will change. I think there's a handful of things that have accelerated and kind of been let out of the box that probably won't go back. So I think this change around telemedicine and services we're able to provide remotely, I think that's here to stay. It's frankly been talked about in healthcare for probably 10 or 15 years about the need to really modernize this and make this more broadly available. And I think there's a subset of patients, probably a large subset of patients, that this is going to be one of the primary ways that they want to interact with healthcare going forward. I think that's a big piece around it. And the other one that I'll just kind of touch on briefly, because I know my counterpart will be able to go into this and do it much more justice than I can around it, is for folks that are on the front line, particularly our folks in Colorado that were hit early with this, or the stories you hear coming out of New York, Italy, or things like that. For the healthcare workers that are at the center of this, caring for these patients who get ill so fast, it's not uncommon that these patients come in the ED, they look okay, and within 20 or 30 minutes, we're needing to put them on a ventilator. It's that rapid that these things happen. I think for those healthcare workers that are exposed to this, for many of them, this will be the hardest thing they ever face in their career. This will feel like the polio epidemic in the past for others. This is going to feel like the Spanish flu. This will feel like one of the worst influenza years we've had, and I don't think we're out of it. I think we're still rising a little bit here in Arizona. I think we will likely taper off probably for a handful of months. But I think if we come back and this continues in the fall, which I think it likely will, and we also have an influenza season that's at least moderately difficult, this will be very, very difficult. I think it'll be traumatic for many of our healthcare workers. I think for many of them, this is going to be very similar to somebody coming back from combat duty, the same type of PTSD experience that folks will have around that. And the reason I think that this will persist for so long and have such a long impact is there's only really three ways to end something like this that's this contagious. One is herd immunity. So enough people get exposed to this that it's very hard for it to transmit around there. And I'll tell you, even New York, which has had one of the most significant outbreaks, seems to only have about a 15% serology positive rate. So about 15% of people in that city seem to have antibodies to this and may have some level of immunity to it. It's probably much lower in Arizona because we've not been hit quite as hard. So you have that, or you come up with a medication that allows us to shorten the course or help patients. And I think there'll be a lot of aggressive work on that. We just haven't found the silver bullet on that yet. Or an immunization for this, which I'll tell you has been very, very difficult in the past for us to make an immunization for coronavirus. It mutates very quickly, very similar to what influenza does. So with all those in mind, I think, the folks that I talk to nationally, certainly the folks on my infection prevention team who are very close to this, I think we all think this to some degree is with us. We all think that we have a second spike coming. And as challenging as this has been for our healthcare workers so far, I think this is going to be even more challenging in the future. And if you've never experienced this before, which most of my physician and nursing and other healthcare worker colleagues have not, this is a very hard thing to move through. Just the sickness of these patients, the risk that they feel that they're personally putting themselves into, even with all the protections in place, because there's just so much uncertainty associated with this. I think it's emotionally a very difficult and draining experience for them. We're trying to do everything we can to support them through it, but I think we're not over this yet.
Thank you, Dr. Holland. We're just pleased that you're a part of it. Thank you so much. We appreciate it. And I know there's a huge, huge team in place. And I know we're going to have a ton of questions for you in a little bit. So sure. Thank you. And your children didn't come in. No.
I can hear them even if you guys can't.
We would have liked to have met them. So, okay, we're gonna turn to Dr. Drain now. And Dr. Drain, I have 3 or 4 questions for you as well. Your primary focus really has been on the educational environment, working with the residents and the students and all that. So what impact have you seen upon, kind of what Dr. Holland was saying, impact have you seen upon the students, specifically in the faculty, but also the residents, the fellows, the frontline caregivers? What have you seen? I'm sure you're in there with them.
Absolutely. So there's obviously been a large change just to the way training has occurred. So most everything for the medical school has moved virtual. Even at the hospital, some of the residents are working from home, and they're kind of doing these shifts to be sure that they always have enough individuals kind of within the hospital and the components. But directly with those who are training, we've seen increases in anxiety, depression, insomnia has been a really recent spike for residents specifically. And then we also have a kind of grief and guilt. It's also been spiking as well within the resident population. Guilt for not necessarily having it as tough as other individuals in New York because they want to help, they want to be providing, they feel for their colleagues. And then just a general grief of, the way things were before are definitely not going to be the way they kind of move forward as we progress. And so there's a really interesting, I guess, mental health need arising at the moment. Early data right now from Wuhan, China shows that healthcare workers report 50% depression, 45% of them are experiencing anxiety, 34% are experiencing insomnia. And then just their overall kind of healthcare workers, 71.5% of them are experiencing some type of psychological distress due to COVID-19 specifically. And so it's something that we are trying our best to help mitigate and provide resources for both the medical students and residents and faculty and such as we move forward, because there is going to be such a need to provide mental health. And as Dr. Holland had explained earlier, there is a lot of trauma kind of occurring with this particular experience. But what I do like to say, and what I like to do with any audience is, especially with immense change that's happened so quickly, it is really normal to experience all of these varying emotions. So not only anxiety and depression, but fear, concern, etc. And that all of these emotions are very normal and very okay to be feeling right now at this moment. And so nothing is wrong with you if you're experiencing them. If they get a little out of hand or you get concerned about them, I always encourage individuals to reach out to professional help and resources. But if you are just feeling some of these things right now, it's all right. The saying goes, change comes quickly, transition takes time, and then transformation comes from understanding, learning, and growing from your experience. So right now we're in transition and transformation. So we have an opportunity as we move forward to.
You mentioned some ways that stress can manifest itself in all of us. You mentioned insomnia. I think we've all experienced that. Grief, guilt, anxiety, depression. What else? Some of my friends are eating a lot. There's weight gain going on. What else?
Absolutely. So just in general, when there's high stress, so you could potentially experience a lot more tension in the body. Again, excess eating or not eating, it can go one way or the other. Anxiety, misplaced anger can be common. Difficulty focusing, having a lot of worrying thoughts, not being able to get out of your head because you're kind of in that stressed state. A lot of antsiness, feeling like you want to do something, you want to get out, or even a lack of energy or loss of energy. And especially with the loss of energy one, that's important if people have histories of depression in their family, to really watch that, because it's okay to have some loss of energy, but if you can't get out of bed, then you really do need to be utilizing professional resources and such to assist with some of these things. But the one thing I really want to emphasize here, especially when talking about stress, is that is a really common term that a lot of people use, like, oh my gosh, I'm so stressed, I'm so stressed, I'm so stressed. It's really key to start labeling exactly what you're feeling, especially in this type of environment. So instead of saying stressed, say, I'm feeling really overwhelmed by what I'm hearing on the news, or, I'm really sad about, specific things that are going on, or I'm really anxious because I feel like I'm not able to do something. So labeling kind of those stress points and really using a larger vocabulary around it will help you also deal and kind of prioritize with some of these stressors. So for example, by labeling and being able to target what you're stressed about as well, it gives you a toolbox to really start tackling some of these specific things that you're stressed about. So, if you're really if you're overwhelmed because you haven't been able to possibly support your family members or elderly family members or young family members, saying, you know, I'm overwhelmed by this. It gives you an opportunity to say, okay, well, what can I do to decrease that overwhelming by either reaching out and connecting with those individuals, maybe setting up an opportunity to have food delivered to them, you know, maybe spending some extra resources or something elsewhere. And so it kind of gives you this like little check mark that you can go through, you know, saying, you know, I'm really upset that I haven't been able to talk to my mom because I've been so busy. Well, it gives you a check mark of, oh, you know, I should call my mom. And then it's something that I don't have to worry about and stress about any longer. And so it can be used as a good tool as you move forward. In general as well, kind of in these times, how to relieve some stress is to acknowledge that the reality we are in is the reality we're in right now. You know, what we resist persists. So the more we say various things shouldn't be this way, even though they are this way, we'll like build that tension and build that tightness and build that anger versus saying, okay, we're at home, you know, we're helping our healthcare workers, we're making a change, you know, this is our current reality, you know, let me face that as we move forward versus saying, well, we shouldn't be doing this. I'm so stressed. You know, I want to go travel. I want to go do, you know, all of those type of things. And then also, you know, recognizing and reflecting about the amazing qualities that you've already utilized to adapt so quickly. You know, there has been a lot of change and there's been a lot of stress, but you as a human being have already made immense changes and huge strides and have accomplished so much in such a small period of time. So being able to recognize that, and although you're not going to be perfect at everything and we're not always going to be able to be perfectly well and happy all the time, is an okay thing to be. And the other thing too is right now, with all the stress going on in the first place and all the changes, I recommend people to watch the tendency to use their time wisely. You don't have to be doing something all the time. You don't have to have a side hustle. You don't have to be learning Spanish. You don't have to be coming up with the next big idea. You know, it is okay to just sit, to be quiet, to listen to some music, to take some time for yourself, because this is a really unusual time. And so taking that time to yourself can be really beneficial too, as you move forward. And at the end of the day, just remember your path is your path. You're like, what this event looks like for you is not going to be the same as what it looks like for somebody else. And be okay with that. There are some people who want to go out and rush and do things, which is great because they bring back new information and they help with immediate needs. But there are things with people who like to sit back a little bit. They're the ones that help keep kind of history and help keep things calm and help keep like things stable. So no matter what type of person you are, it's perfectly okay. Be okay with your path and as you go forward, and just know that what you're doing is enough at the moment. So I guess it was a little long-winded, but that's how I would recommend dealing.
Oh, those are some great tools and techniques. Are you telling the residents, the fellows, the medical students the same information? What are you sharing with them? Because they're right in the middle of all this. What do you say to them?
So, I mean, I've told some of them this, like I'll write an email with some of these things, but as far as even direct, so there's two types. So there's the direct things that they can be doing for their personal well-being. Mm-hmm. And I'm happy to go over those as well, of, you know, things such as keeping a routine. So a lot of them are working from home at the moment. So I encourage them to keep a routine, create to-do lists, and write out just daily tasks and goals. So for example, even part of that, I encourage them to include mental health goals or physical goals kind of within their normal work that they already have to do, especially if they're working from home, whether that's go for a walk or meditate for 5 minutes or something. And it helps keep a normal routine. I encourage them to practice gratitude and mindfulness is something, and anyone can do these. These are great practices to do on the regular, but some of that is, you know, make a list of 3 things that you are grateful for that occurred that day. And part of that is, no matter what day it is, no matter how bad of a day it's been, there's always 3 things that you can be grateful for, and you can switch them up, etc. And they can be so simple. So for example, I was really happy that the coffee pot was already done brewing this morning when I went downstairs to start working. You know, I was really glad to have my dog right here by my feet as I do these presentations and work from home. And I've been really fortunate to have air conditioning that's working and blowing on me right now as I'm in a jacket, and have an opportunity to do that. And so they can be really simple things, but that practice naturally turns into more positivity, which naturally helps people feel better. What else?
Well, those are all very applicable to us as well as to the caregivers, for sure. Anything
Absolutely.
else you want to add to that list?
I would say another good one too is do something nice for someone or yourself. I know it sounds so simple, but it helps us feel empowered and productive. But it could be anything from volunteering or helping a family member with a project or doing something for yourself you've really been putting off, because it's pretty simple, but doing something nice makes people feel a lot better. And then the simplest one, get enough sleep and stay hydrated. It's a tale as old as time. If you can do that one thing or do those two things, it'll naturally make you feel a little less stressed and a little bit better.
Some of us have elderly parents. We can or can't be with them. Some of my friends exhibit, some days they're very stressed. Other days they're not as stressed. How can we best help support them? And you've kind of touched on it a little bit, but how can we best help to support other people? Because that makes me feel good.
I think that's a great question, because right now there is a lot of kind of emotional support that we're doing to help people as we go forward. And so there's actually 4 techniques that I typically recommend, especially when you're emotionally supporting others. And that the first one is listen without the need to fix. So we have a tendency when we see others' pain that we try to take it away from them. And, we want to fix the issue. Really, most of the time, people just want to be heard. They want to be kind of witnessed in what they're experiencing. So a simple practice is to just reflect back on what you heard the person say. And then just kind of support them in whatever they need. And if they ask for advice or ask for how you would fix it, by all means do that. But most of the time, they're just wanting to share some of the things that they're feeling, they're going through. The other one is be watchful for the tendency of rumination, meaning sometimes we can get in conversations that aren't necessarily healthy. We are talking about all of the bad things going on, but we're not talking about any solutions on how to relieve any of the bad things that are going on. So if you notice that in those conversations, you can kind of end it a little lightheartedly and just say, oh my gosh, we've just spent an hour in a sea of horribleness. Let's figure out how we get out of this. And it's a really nice way to pivot, especially when there's a lot of stuff going on. And share another technique is to share what you're feeling rather than what you've read or heard. So it's a natural tendency for us, did you see on the news that X is happening and da-da-da-da, and you kind of go off rather than saying, I'm just feeling a little discouraged right now. And I really would like to talk about the discouragement part of what I'm feeling versus the thing that is out in the news or etc. So it's really important to do that. And when you are sharing this information, share your truth as well. So the more vulnerable you are with people, the more vulnerable they'll be in return. And that's just a natural fact of things. And so the key is when somebody is vulnerable and opens up about things, and we actually are seeing a trend even amongst medical students and people in general, that people are becoming a little bit more connected. They're trying to connect by sharing those vulnerabilities. So it's definitely okay, but just my encouragement is to support others when they reach out.
Very good. Yeah, I notice sometimes I try to fix things, I think we all do, instead of just listening. So, and I think women are better at probably listening and less try to fix than men, but I don't know if that's true or not, but it's an experience that I've had. They always try to fix the problem. So maybe women need to talk to women and
But and I guess that goes to my final one, which I almost forgot, is your process is your process and so is theirs. So everyone processes things completely different and manages circumstances differently. And so you may not understand why somebody is feeling something some way, or not necessarily experiencing it enough, but it's okay for people to not be at the same point and not the same place. And it's perfectly okay.
I think also not watching the news day in and day out. Don't you? That's one thing that is just, it's very stressful to do that. Right?
Yeah, and so that is actually a great point. One of the things that I recommend, and that's this for anybody, is pick 1 to 3 news sources that you use, and only use those 3 news sources, because with social media and all of this stuff out there, if you just can narrow it down and consume smaller chunks of information, it's really beneficial. So, you know, one of mine is NPR, but another one is I get emails from Banner. I consider that COVID-19 news. So NPR, I have kind of the COVID-19 news, and then I have the research that's coming out. And those are the only kind of news sources that I'm relying on, because without that, there's a lot else going on.
Absolutely. Absolutely. Okay. Thank you, Dr. Drain. I was taking notes here. Wonderful, wonderful suggestions, honestly. And I know the folks on the line here are going to, or on our Zoom meeting, going to have questions for both Dr. Holland and Dr. Drain. So I'm going to open it up to folks. You can start asking questions. Now remember, you need to unmute yourself, state your name, and then mute yourself back if you would. But we have 2 wonderful experts here, and I've got a list this long. So just start. Why doesn't somebody just want to start and ask a question? Please start. Okay, I'll ask a question. This is kind of a technical question, and I don't know that it's appropriate. Probably more for Dr. Holland right now, because my background is in healthcare. I was curious how they are doubling people up on ventilators. How can you do that in a safe manner? And many people have, you know, they'll be on PEEP, or they'll be on different amounts of oxygen. How do you do that? How is that even possible, or have you done that at Banner?
No, we're not currently doing that at Banner.
Okay.
But let me maybe explain a couple of pieces to your point, because it's amazing how many things come up that are, to your point, there's nuances and technical pieces to it.
Right.
And I think I have been a part of more of those conversations in the last 4 to 5 weeks than I have probably in the last 10 years. There's just been so much of that. So in the case of ventilators and potentially putting 2 people on the same ventilator, one of the real challenges is you have to try to match the patients well together. So you have to match 2 patients that need roughly the same amount of pressure coming in through the ventilator, and that have lungs that have relatively the same level of elasticity to them, so they can expand and contract. Otherwise, if you give one person who doesn't need a lot of pressure in the ventilator a lot of pressure, you can actually cause trauma to the lungs, which makes it harder for them to recover. And so the only times that you would probably embark on that, or even moving into a space like I was mentioning earlier of using very non-traditional ventilators, would be a space where you're almost at what's called, there you go, you hear some noise from my kids probably, but sorry.
That's okay.
Who's at the front door?
Perfect. So those pieces where you've got those, you would only do those in situations where there's a crisis of care. So we're running out of beds, we're running out of people to manage the ventilators, we're running out of ventilators. So you do everything you can to avoid that. And frankly, those types of situations would only occur if the entire state had run out of beds, ventilators, and all of that. So both Banner would use its resources to make sure that we were balancing, and then all the health systems would come together to do that. But if we needed to do that, the types of things we would do is just like I described. We would try to match patients together to be able to put it on that. And there are protocols and mechanical designs to pull that off. It's just very, very challenging, and there is some significant risk associated with it. I think what we would more likely see are using CPAP machines or BiPAP machines, which are what folks can use at home sometimes with sleep apnea, but using those on patients to be able to provide some positive airway pressure to get the air in, and also allow us to oxygenate. And then one of the things that you probably see quite a bit of coming out of the news, I think in Chicago in particular, is what they call high flow oxygen and proning. If you guys have read about that at all, read about that a little bit. So the idea for that is that there's probably a subset of patients with coronavirus that actually do better not being put on the ventilator. And with those particular patients, using very high amounts of oxygen can sometimes raise their oxygen level from 70%, which is where some of these patients come in, all the way up into the mid-90s, which is a fairly normal range to be in. And then also, sometimes just position. Having patients lay on their back seems to not open up the lungs as well as having patients lay on their trunk or their stomach. And so that's called proning. We would float them over kind of onto their belly and then use positive or high flow oxygen for them. So those are all conversations. We've actually had some of our critical care docs develop a protocol at Banner for how we go about doing that. And we've educated our clinicians around it. And then one of the other ones that's fascinating that I learned about the other day is our critical care physicians are all on an app that they've developed that allows them to communicate and share new things that they've read about, new articles that they found, and things like that. So throughout the day, they're constantly sharing information like that. So sorry, long answer to your question, but imagine that there's a conversation just like that one for just about every topic you can imagine around COVID right now. And it's a really interesting time, and I think it's bringing out the best of a lot of people who have some amazing ideas of how to do this. And I think what I'm learning as a leader, one of the most important things is just knowing when to listen and be able to hear those and how to help grab those really brilliant ideas and get them visibility and some airtime. So we're trying to have a very strong listening ear around a lot of this.
Very good. Thank you.
Susan, I have a question. It's Lois.
Go ahead.
The question is around masks. What is this? The information seems to be changing all the time. What is the current best practice for all of us in regard to masks? When should we be using them? When should we not necessarily need them and feel that we can be safe?
Sure. So I can give you my guidance, and then if it's okay, and if it's okay, maybe I could also just give you a little thought about where your biggest risk is with a mask, because this is a conversation I have pretty regularly. I think number one, if you're going to be outside, you're going to be more than 6 feet away from someone else. I think your risk is fairly low, actually, of being exposed to it. Things dissipate out in the outside environment, and having that distance apart, I think is very helpful. Outside of that, certainly if you're coming into one of our hospitals, if you've got a mask, we encourage you to wear it. If not, we provide one to you because we think that can help prevent the spread. And wearing a mask actually does a couple of things. One is it may decrease your exposure by wearing the mask, but actually what it does the most is it helps prevent people around you from being exposed to anything that you might be carrying because it holds it close there. So that would be my advice, would be if you're out in public, you're around people, you're going to be within 6 feet, you're going to the grocery store, things like that, I think it's very reasonable to wear a cloth mask or a mask of that type while you're out that. That's not the N95s, the big, uncomfortable, bulky masks that you see people wearing. Those are for very specific procedures that we do, but I think wearing a mask outside of that is a very reasonable thing to do. And then my second piece that I would tell you about it is, to be honest with you, people's risk, even in the hospital in a high-risk environment where there are a lot of patients with COVID, the risk actually isn't, for the most part, picking the right mask to wear. It's frankly how you take the mask off when you're done wearing it. I know that seems a little bit counterintuitive, but the risk with masking is actually self-inoculation. So your risk of actually exposing yourself to something that might have got on the outside of the mask while you're out there. And so we go through a whole process where we encourage folks, number one, wash your hands before you take your mask off. Seems like a very basic thing, but if you got a mask on and you're going to take it off, wash your hands before you touch it. If it's one that loops over the ears, you would take it off one ear than the other and carefully take it off such that you're not touching the side that is potentially contaminated from being out there around folks. And then the next thing that you want to do when you get done is wash your hands again. And it's no different than, I do with my 5-year-old, who frankly, it's a surprise for him after going to the bathroom every time that he's got to wash his hands. And every night it's a surprise he has to brush his teeth. But, I've got him singing a song for 20 seconds. The happy birthday song is the right one to do. It's about 20 seconds long. And washing your hands for 20 seconds actually has more impact than just about anything else you can do on your risk of getting exposed. So those are kind of the things that we're teaching folks to do. We've been doing it for a long time. I think folks are hearing this to a different level now just because the risk is more imminent and you're seeing it more day to day. But it's how you use and take off the mask is probably infinitely more important than which mask you decided to put on.
Very good. Other questions?
I have a question, Alice and Lewis. And thank you both for all you're doing and for your input. We really appreciate it. So, what can we do? I mean, we are most of us are not in the healthcare world, but we know people who are, spouses of people that we know, their kids, and just wondering, are there things that we can do for them just besides tell them how much we appreciate them? Is there anything you think that those of us that are lay people can help both of you mentioned how stressed the healthcare workers are, so understandably, and I just wonder how we can help.
Yeah, so maybe I'll start, and then if I could hand it over. I think, on the first part, I think awareness is really important in conversation around it. I think even all the work I suspect all of you have already done to encourage social distancing and staying at home and things like that have a huge impact on all of that. And then I think as time goes on and this plays out a little bit more, I think there's going to be more and more conversations about the emotional toll and impact this has had, yes, on healthcare workers, but frankly on our communities too. This is going to be very, very impactful. I think being a part of helping to lead our communities back from this is going through a situation like this that I can't imagine any of us will go through this without having someone we know personally and we feel strongly about being impacted by this. I think going through a situation like that, there's going to be a lot of healing that's needed in the organization. So I think awareness, being mindful around that are probably the biggest steps out of the gate. And then I think as we get further along, I think there's going to be even more opportunities around this. But Dr. Drain, I'll hand it over to you. I'm sure you've got some more immediate things than I do. In fact, I've liked some of your advice you've given so far. There's a couple things that I want to try. I'm going to get excited about the coffee tomorrow morning, I've decided.
No, so I think you hit the nail on the head with some of the bigger things. But if you want some really practical, tangible things that I've been hearing that people have been taking away is, there is a sense of isolation with some students and, residents, and I'm sure the same with attendings and stuff. So just connecting, even a text message or an email just saying, hey, you were in my thoughts. I hope you're doing well. Feel free to reach out if you need anything, can be beneficial because it gives somebody an outlet to reach out if they need to. I talked about emotionally supporting earlier, just listening sometimes because there's a lot going on and a lot happening. It could be beneficial for those who you are able to connect with. I know people also want to make masks and feel like they're contributing and able to help others. I mean, feel free to do that as well. There are a lot of volunteer opportunities that I know Banner has put out to the community as well. So I definitely encourage that type of stuff. But I mean, really the big one as we go forward is going to be awareness, but also advocating for mental health resources for everyone as we move forward, because they're going to be needed more now than we've needed them in the recent future or in past history. So of what we see, at least in research too, so after traumas like 9/11, et cetera, there were issues or mental health needs and concerns for 1 to 2 years after the event actually occurred from those first responders and stuff. So this isn't going to end very quickly as far as the mental health need. It actually is going to extend past the pandemic.
Thank you.
Thank you.
I do have one cool thing just to tell you guys. I don't know if you know about this, but Luke Air Force Base is doing a flyover tomorrow afternoon in celebration and to salute the essential care workers. And I was looking at the map of where they're going to come from. It looks like they'll be over Scottsdale PV area about 3:20, 3:30 tomorrow. So it's a very cool thing and nice of them to do.
Very cool.
Yeah, I'd heard about that. We're actually canceling our EOC meetings during that time tomorrow, just kind of in respect for that. But it's a really neat thing they're doing.
Very cool. Yeah. Other questions for Dr. Holland or Dr. Drain? I have another one. I think, did someone have a question?
Oh, yes. This is Linda
Please,
Muller. And I had a question. We obviously have had the hot spots of the Navajo Nation in Flagstaff and sort of some nursing home situations here in the state, but we still seem to have a continued, increase daily in infections. So where are our next hotspots, and what, if anything, can we do to stop that? Because we're all sort of staying at home.
Yeah, I think so. Just making sure I'm off mute as I start talking. So I think there's a couple of pieces around it. One, this is a highly contagious virus. So I think even in the best of circumstances, this will continue to spread to some degree. And really the goal with all of this is to make sure that we can keep the spread as low as we can, and that we can help protect folks that are particularly susceptible from being exposed to this. And so that's a lot of the work that you'll see around this. I think personally where we're going to see more of the hotspots is we will see more of the skilled nursing facilities, rehab facilities, anything that's kind of a congregate setting type thing, even correctional facilities. I think we might see some more outbreaks in those types of things where you have lots of people in close proximity together, and you have lots of people coming in and out of those environments. I do have to commend what's been done in Arizona. I think one of the reasons that we didn't see an early spike like you saw in other cities, and one of the reasons, even though our cases are going up, it hasn't gone up as rapidly as some other places, is I think number one, the focus on social distancing early on. The fact that it came from mayors, the governor, and others very early on was hugely impactful in allowing the trajectory to be a little bit more muted than what we're seeing in other places. I am very concerned, as I suspect many clinicians are, that as we start to loosen those relaxations, that we might see things start to increase a little bit more. But I know there are a lot of good processes in place to watch. So I think it's going to be congregate setting type environments, places where you have a lot of folks very close together, that you'll start to see more of it. And I do think that something like this, until either we have enough people that have been exposed and have immunity, or we have a vaccine, or we have great early treatment for this, I do think we will see this continue to slowly spread through many of our cities. I don't know if that completely answers your question, but I think it'll be a lot of the same places we're seeing it, just in more depth than we've seen it so far.
Thank you.
Sure.
We have time for probably 1-2 more questions. More questions? I'm going to ask mine then, okay? My question is, this is to Dr. Drain. Everybody is currently working from home right now, and it's a new process. It's very different than what it was before. What are the pros and cons of that from a psychological perspective? I mean, there's pros and cons. It saves gas and other things, but from a psychological perspective, what's that going to do for workers? And we may end up working from home in the future as well. It seems to be working pretty well, but how is that going to affect people?
Well, I think that's a really interesting question, and I don't think we know the full psychological kind of toll of how, with this many people, working from home and what they're experiencing. I do know that it is impacting people differently. So there are some kind of personality traits within us. There are some more kind of homebodies, more introverts sometimes aren't minding this type of environment quite as much, where those who are a little bit more extroverted and require individuals to be around frequently are struggling a little bit more while we're working from home and in these new situations. And so I would definitely say that as we move forward, there are different tricks and tips that I would also recommend kind of from working from home. I feel like that's mainly what I do, is just offer some random advice. But, as we're working from home, it's really important too that we're separating work and home
Mm-hmm.
because it can be really easy to just get lost and constantly be working on something or constantly answering emails because it's right there within kind of your vicinity. And so I really recommend kind of sticking to very specific times, just like a traditional work day, and going through those routines. I recommend trying to get your workspace out of your living space. So if you have the option to put it in a bedroom, or if you have an option to put it in an office, it's typically the best option to do, rather than putting it in the kitchen, etc., because that's where you go to enjoy your time after this. And so there are things that can be done, but essentially, I guess whatever anybody's going through right now, it'll be really interesting to see how it all plays out as we go into the future, because I have a feeling things will become more virtual.
Very good, thank you. All right, one last little item I wanted to cover is many people, and this is kind of a piggyback on what Allison Lewis just asked a minute ago. Many folks have been asking me, maybe because of our Banner connection, what can we do? What could we do to help Banner, the frontline folks at Banner? What could we do? How can we be the most helpful? And so I've asked Andy Peterson, who is the president and CEO of the Banner Foundation, to just spend a couple minutes and talk about how people can actually help in the best way possible. So Andy, I think you're there. If you could take the floor for just a few minutes, please.
Yeah, well, thanks, Suzanne. First of all, thank you to both physicians for sharing your information with us. Very, very helpful. Some tips we've heard before, but always a good reminder. And Suzanne and the rest of the WISP committee, I appreciate you putting this together. This was our first one, and I think we can take input from the members and determine who they want to hear from as time goes on, and determine the direction. So thank you for putting it together. Yeah, a couple things. Dr. Holland, you said sometimes a pandemic like this or a challenging situation brings out the best in people, and we've seen a lot of that too. It doesn't always get talked about, but we've seen a lot of that. And Dr. Drain, you said, one good way to listen is to listen without fixing. But if you want to fix something, I can give you a few ideas on potentially how to fix or help the situation. So initially and right off the bat, 8 weeks ago, the Banner Health Foundation started its COVID-19 fund. And initially and really through this day, it was meant to help with anything that comes up that we just weren't expecting. So additional PPE, additional staffing for certain areas of the hospital. But at the same time, we also started we expanded what we call our SOS fund. And that's serving our staff. And this is a funds we raise each year from all Banner employees that are available to all Banner employees who are experiencing a financial hardship. But we've expanded that fund to help with childcare and other needs during this time. So it's a fund that helps Banner employees. And I want to give a shout out, because I know some of you listening on this right now have already donated to that, and I want to thank you for that. Just to give you a sense of how critical that has become, that fund. We've gone from about 12 requests a month to about 450 requests a month. And these are for Banner employees. Often they are serving on the front line. But as schools closed down, some of them found themselves not able to come to work because they didn't have childcare. So the fund helps in various different ways. In terms of community donations, there were some inquiries about masks, and Mary Joy, I heard you say that you've been making masks, and others I know have been. We absolutely are in need of those homemade masks, those social comfort masks. We have a goal of 100,000 masks. We've raised just close to 75,000 already. So we're well on our way. We also always need donations of PPE. So you may not have that yourself, but you may know companies that have them. People from Leslie's Pool Mart to Cox Communications to Microsoft have donated PPE. You may know people at those organizations who have contacts who can donate. We need them. And then you may also want to consider donating, or those that you know who have actually been affected by the virus. We also have the need for convalescent plasma donations. So this is really we're part of a nationwide effort to recruit plasma donors and use that valuable blood as part of treatment protocol for the COVID-19 patients. Those who have recovered from COVID-19, they must be about 14 days minimum out from recovery. We can use their antibodies to in their blood to treat critically ill COVID-19 patients. So we are looking for, if you've had it or someone you know has had it, this is something they may want to consider. And then I also wanted to tell you about something that's ongoing, but we've expanded it in a big way. We have a program at Banner called Cultivating Happiness in Medicine. And this is a program that was started a number of years ago. I think Dr. Holland, you may have been a part of it when it was originally started, as well as Marjorie Bessel and some others within Banner. And essentially, it focuses on a lot of the things, Dr. Drain, that you were talking about. And it talks about burnout and long-term stress in caregivers, and how it can show up in exhaustion and their inability to take care of patients. And so this fund has been established to help build coping mechanisms as well as evidence. It is an evidence-based approach to essentially help caregivers build resiliency for these stressors and these burnouts. So if you're interested in getting involved in that, donating to that, or somebody that would be, just have them reach out to one of us at the foundation, whether it's me or Christine or Lauren. Those are financial ways to get involved and help. And then I also want to mention briefly that there's been so many great people in the community. You may have seen a clip last night. Larry Fitzgerald was delivering food to various nurses and to some departments within the hospital. We are working with a number of different caterers in town to deliver food and easy to go lunches or dinners for frontline care workers, and we're very much interested in getting food and just nutritious snacks to them. I can't tell you how much they appreciate that. So they may seem like small ways, but it means a tremendous amount to those on the front line. They're coming from a shift, going into a shift, to be able to have a nutritious meal or vitamin water or anything that can kind of lift their spirits so that they can go home and be with their family, or that they can go in starting their shift ready to go. And if you have any other thoughts, we're open to creative ideas. Just give me a call, send me an email, text, whatever the case might be, because as Dr. Holland and Dr. Drain have mentioned, the needs continue to change. And what we need today may change in a month or 2 or 3. So thanks for the opportunity, and I really appreciate it. I just want to give a shout out to so many of you who have already done that. It goes a long way, and quite frankly, it inspires others to do the same. So thank you.
Thank you, Andy. And I want to thank everybody for participating today, especially Dr. Holland and Dr. Drain. We appreciate your time and certainly your expertise. Thank you for everything that you're doing. It's remarkable. We so appreciate it.
Thank you for having me.
And I want to also thank the board for putting this together today, the WISP board for putting this together. I think almost everybody from the board was able to join us today. So with that, I guess, as everybody says, be safe, take care of yourselves, right? Both mentally and physically. And until we meet again, be safe. All righty. Bye-bye. Thank you.
Bye.
Thanks
Thank
for
you.
doing this.